In this presentation, we will review the cranium, mandible, and sinuses, the SMV projection. Image analysis guidelines for the SMV projection state that the mandibular mentum and nasal fossa are demonstrated just anterior to the ethmoid sinuses. Distances from the mandibular ramus and body to the lateral cranial cortex on both sides should be demonstrated as equal. The vomer, bony nasal septum, and dens are aligned with the long axis of the exposure field. For the cranium, when taking the SMV projection, the dens should be demonstrated at the center of the exposure field. For the sinuses and mandible, the sphenoid sinuses are demonstrated at the center of the exposure field. For the cranium, the mandible and the outer cranial cortices are all included within the exposure field. When taking the SMV for the sinuses and mandible, the mandible, lateral cranial cortices, and the mastoid air cells are to be included within the exposure field. For this projection, just wanted to talk about a couple positioning procedures. You want to elevate the chin and hyperflex that neck until that IOML is aligned parallel with the IR. Your central ray is going to be perpendicular for the cranium to the mid-sagittal plane at a level of, or at the level just anterior to the EAM. For the sinuses and mandible, your central ray is going to be perpendicular to the mid-sagittal plane at a level of 1.5 to 2 inches inferior to the mandibular symphysis. I have included your image analysis guidelines for you on this projection. You can, or on this, slide. You can review this at your leisure. And here is another projection of the SMV. So let's talk about positioning errors in relationship to the IOML alignment. In this case, when the neck is underextended, you will see that the mandibular mentum is demonstrated posterior to the ethmoid sinuses. In this case, you need to extend that flexion of the neck to place that IOML parallel with the IR, and in order to achieve the appropriate image of the SMV. In overextension, where the IOML is not parallel with the IR, the mandibular mentum will be demonstrated too far anterior to the ethmoid sinuses. I would like to make a side note that typically patients do not have a problem with overextension. You will typically experience the underextension. So this is a rare case. But in this case, in over or under extension, when there is misposition of the IOML, there is a distortion of the nasal fossa, ethmoid sinuses, and foramen ovale and spinosum. So we want to repeat this image because we're not adequately visualizing the anatomy that we are trying to demonstrate in the SMV projection. So let's talk about cranial tilting in the SMV projection. Cranial tilting occurs in the SMV projection when the image-sagittal plane is not aligned perpendicular to the IR. This, like I said, results in cranial tilting. It can be identified on the SMV projection by comparing the distances from the mandibular ramus and body with the distance to the corresponding lateral cranial cortex on either side. If the head's not tilted, then the distances will be equal, but if the head's tilted, then the distance is greater on the side which the cranial vertex was tilted, so the top of the cranium. In this projection, the top of the head is tilted towards the right. Also in this projection, you can see that the mandibular mentum is not in place where it should be above the ethmoid sinuses. So we have some underextension of the neck here. In order, obviously, to correct this is to bring that mid-sagittal plane perpendicular with the IR and bring that IOML parallel with the IR to ensure a proper image is obtained. So let's review an SMV practice analysis of the cranium. First, we want to look for tilt, rotation, or any mispositioning with the IOML. In looking at this, we look at the mandibular rami here and their distances from the cranial cortex, and you can see that it is greater on one side than it is over on this left side, meaning that the vertex or the top of the head was tilted towards the right side. So we got to fix the tilt, okay? So we're going to bring the cranial cortex towards that left side until the cranium's MSV is perpendicular with the IR. Then you want to look at the mandibular mentum here, okay? And it is within the ethmoid sinuses. So we are still a little underextended. You want to hyperextend that neck until the IOML is parallel with the IR to ensure you get an adequate image. This concludes the projection or the presentation on the SMV projection. If you have any questions, please feel free to reach out to me via email or at clinic. Thank you for participating in the presentation.